Hey everyone, this is my final project for EGS 310. I decided to combine three different complex issues instead of just focusing on one. So homelessness, drug addiction, and mental illness. And I will be talking about how America's flawed healthcare system is the catalyst for all three of these issues. I just have a content slide here to give you an idea of what the presentation will contain. I have a small introduction slide, and then directly after that there is a about 6-minute YouTube video. I cannot play that in the presentation, but I will leave a link to it for anyone who does want to watch it. It's very good. It's the stories from people who have experienced all three of these issues, and it's very emotional, but I highly suggest watching it. Like I said, it's about 6 minutes, so it's not bad. Not too long. And then I'll move on to mental illness in the USA, access to healthcare, and then drug abuse, homelessness, all three, and possible solutions for all three, as well as what we as citizens can do to combat these issues. So for the introduction, there's just a few sentences here, pretty much reiterating what I already said about how the USA is overflowing with people struggling with homelessness, drug addiction, and mental illness, as I'm sure all of you know or even have experienced yourself, and how the lack of accessible healthcare in the USA is the catalyst for all three of these issues. Here's the YouTube video. It will not let me play it, but like I said, I will leave a link somewhere in here so that you can click it and watch it if you choose to. Here are some statistics from the Mental Health in America 2003 report. There's also a link here for that report. It is around 20 or 30 pages. It's very interesting and disappointing, as you'll hear in a moment. So as of 2023, 21% of adults experience mental illness, while 16% of youth experience major depression. Now, 21% is around 50 million Americans. And 60% of youth who suffer with major depression receive no treatment for that illness. 55% of Americans suffering from mental illness receive no medical treatment. So that is over 25 million Americans. 11% of adults with mental illnesses have no insurance, and 15% of adults that have had substance abuse disorders in the last year, 93% of them received no treatment for their illness. Just some more a visual here from the Mental Health in America 2023 report. As you can see, Ohio is in the top 15 of the states with the highest prevalence of mental health and substance abuse issues. This includes adults with mental illness, adults with substance abuse, adults with thoughts of suicide, youth with at least one major depressive episode, youth with substance abuse disorder, and it essentially combines all of those measures and gives you a visual of what states have it the worst, essentially. And the darker the state is, the worse these issues are. And as you can see, Ohio is one of the darkest. And here are some statistics about the access to healthcare in the USA. And this is from a scholarly journal located in the National Library of Medicine. And the link is also there in case you wanted to look at that as well. But over 37 million Americans are entirely without health insurance, and 41 million more have inadequate access to care. And what's interesting is, despite the USA essentially having and putting so much money towards healthcare, the USA does rank below 30 other countries for many public health indicators like preventable deaths, infant survival, maternal mortality, and overall life expectancy. So you would think that with the money that's put into it, that we would have better numbers, but we do not. Now moving on to drug abuse in the USA. These statistics are from the National Center for Drug Abuse Statistics. There's a link to that as well. But let's get started reading these. I'm not going to read the exact numbers, but I'm going to give a ballpark here. Over 138 million, or half of people aged 12 and over, have used drugs in their lifetime. Over 28 million have an alcohol use disorder. And that is 28 million of over 138 million Americans that drink alcohol. 27% of those with drug disorders have an opioid disorder. Over 70,000 drug overdose deaths occur in the U.S. annually. Actually, according to this source, accidental drug overdose is the leading cause of death for people under the age of 45. And that number increases at an annual rate of 4% every year. Some risk factors, according to the Families for Addiction Recovery website, as I've highlighted in red here, mental health disorders such as anxiety, depression, ADHD, or PTSD can lead to problematic substance abuse. Essentially, these people are typically unable to afford actual health care for their disorders, so they self-medicate using drugs. And it's a double-edged sword because people who are at risk for mental health disorders increase that risk when they use drugs chronically. Some more statistics about the homelessness in the USA. This is as of 2022. I can't imagine these numbers have improved in 2023. This is according to the National Alliance to End Homelessness website, which I highly suggest going through. They have amazing statistics and resources that everyday citizens can look at and try to contribute towards. But over 582,000 people are experiencing homelessness across America. That is around 18 out of every 10,000 people, which doesn't sound like a lot, but it most definitely is. 72% of people experiencing homelessness are adults, individual adults, but 28% were people living in families with children, which adds an entire, other level of tragedy to these statistics. Some risk factors for homelessness. Unsurprisingly, more than 10% of people who seek substance abuse or mental health treatment in our public health system are homeless, which we're kind of getting into the intersectionality of these three issues. People who have mental health and substance abuse disorders and who are homeless, so all three of these, are much more likely to have life-threatening physical illnesses or live in dangerous, crime-ridden conditions. And this is all according to the National Alliance to End Homelessness, once again, which is linked here in case anyone wants to look through it. This slide just has a little cycle that I made. So it's essentially the vicious cycle of mental illness, drug abuse, and homelessness in the USA. So this cycle doesn't have a starting or ending point. I'm just going to read it, but it doesn't necessarily start at drug abuse, but I'm just going to start there. Drug abuse is a form of numbing or coping, which typically can move into homelessness as a result of drug abuse or the inability to function, which leads to worsening mental health as a result of drug abuse, poverty, or homelessness. And then these are unresolved mental illnesses due to a lack of medical costs, lack of insurance, and then it just kind of keeps going in a circle. So the center of all of this is the lack of accessible healthcare for most Americans. This is according to the source I mentioned earlier from the National Library of Medicine. These are some possible solutions to inaccessible healthcare. These include reduced fees for hospital and clinical services, a unified system for billing and administration, pharmaceutical price negotiations, expansion of coverage and services, and an interesting bit of research here, also from the source, is the average cost of giving birth in Spain is around $2,300 compared to almost $15,000 in the US. But the rate of neonatal mortality in the US is double that of Spain's. So it kind of makes you wonder a little bit here. It's more expensive, but the care that we're receiving is less than. And then moving on to possible solutions for drug abuse. This is according to the Substance Abuse and Mental Health Services Administration, which is linked here as well in case anyone wants to look through that. But the list of possible solutions they provide include providing support to states, territories, tribes, and communities for programs and projects that address the prevention and reduction of substance abuse and misuse. This typically targets youth because that is typically where mental illness and trauma and drug abuse begins. And then there's the enhancement of protective factors, preventing or delaying the initiation of substance abuse, once again in youth usually. The increase of public awareness of the negative consequences of substance abuse, and the technical assistance and training to communities and organizations that are interested in establishing and expanding these prevention programs. So more funding and assistance for, the organizations that are trying to combat these issues already. As you know, a lot of those are nonprofit, and they often rely on donations, which is a whole other issue to have to go into. But and then there's possible solutions for homelessness. And this is according, once again, to the National Alliance to End Homelessness, which is an amazing site. I got all of my information about homelessness from that website. But a few of their solutions include a community-wide approach to delivering services, housing, and programs, emphasis on community. It's going to take a lot of effort of people working together to do that. And there's rapid rehousing used to connect people to housing and services. Permanent supportive housing obviously has been a proven solution to homelessness. An effective crisis response that can help people quickly exit homelessness. And then finally, programs designed to assist low-income people to increase their income to stop homelessness from happening in the first place. And then what can we do as citizens to help all three of these issues? We can spread awareness and combat negative stigmas about, the homeless, those suffering from drug addictions and mental illnesses. We can volunteer at shelters, rehabs, etc. We can donate clothing, food, medical supplies. And even if you can't do any of these, spreading awareness is a great help as well. Encourage others to seek help, provide information about resources. If you know someone who is struggling with any of these issues, try to connect them to the resources that are available. Sorry, someone just rang my doorbell. and you can educate yourself and others on these issues. A lot of people who don't struggle with these issues like to remain blissfully ignorant because it doesn't affect them, and that is extremely dangerous. So please educate yourself if you haven't already, which I know many of us who are, young adults and college students, we know about these issues, but there are people who either are unwilling to learn or just do not know. So please educate others, and hopefully working together as a community and as a country, we can eventually try and combat these very extreme issues that affect this country. And then these are just my works cited, which I mentioned all of these previously, but here's just a list of them. Um, and then a little thank you for watching. I know that was a lot of information all at once, but there's a little quote at the bottom here that says, "The big picture is made up of details," and that is 100% true for this issue and for the solutions. So thank you once again for watching. I hope you learned something, and I will make sure to add that YouTube link somewhere in here so that you can watch it if you choose to do so.